I want us to look at the things that you need to know about hormonal imbalance. And hormonal imbalances actually refers to an abnormality in the levels of your hormones. So they could be very high and they can also be very low. And this abnormality disrupts the normal functioning of the various physiological processes in your body. Now, I also wanted to understand that hormones are chemical messengers that are produced by your endocrine system, your endocrine glands, and are essential for regulating numerous bodily functions. So, your hormones are responsible for your metabolism. If you are having a slow metabolic rate, blame it on your hormones. And growth also is determined by your hormones, development is determined by your hormones, reproduction is determined by your hormones. So most cases of infertility is actually caused by hormonal imbalance. And then your mood, your sleep, and even the texture of your skin. If you have smooth healthy skin, it is an indication that your hormones are balanced. And for acne prone skin, it means that you may be suffering from hormonal imbalance. Now, there are several factors that can contribute to hormonal imbalance, and I want to quickly help you to understand some of the factors that contribute to hormonal imbalance. The first one is endocrine disorders, and these are disorders that affect the endocrine glands. And remember, I told you that hormones are produced by your endocrine glands, and there are some of these factors that can disrupt your endocrine gland and cause an imbalance in your hormone. The first one is thyroid or pituitary glands. So your thyroid gland can actually affect your hormones and upset your hormonal imbalance. Your pituitary gland can also do that when there is a problem with it. Your adrenal glands, your pancreas. Now, this can lead to hormonal imbalances. And of course, when there is a problem with the thyroid hormone or the thyroid gland, rather, you have conditions such as hypothyroidism, hyperthyroidism. There could also be diabetes, there could be adrenal insufficiency, and these can disrupt the production and the regulation of your hormones. So, we also have menopause and aging. And I wanted to understand that as you approach menopause from 35 and in most cases 40 years, but whilst you are approaching this landmark, kind of, you experience hormonal changes naturally. So your hormones are going to go through lots of fluctuations this period during your menopause and as you age. And this can lead to estrogen being too high, progesterone being too low, testosterone levels can drop, especially in men. So these changes can result in symptoms such as hot flashes, mood swings, change in libido, lack of sexual desire, right? Low libido. And then another factor that can also disrupt your that can cause a disruption in your hormone is chronic stress. And I say that you need to deal with stress. As a matter of fact, stress can increase your level of cortisol, which is very, very damaging to your system. So the primary stress hormone is cortisol, and when you are stressed, cortisol is released, and this cortisol can lead to hormonal imbalance. Now, cortisol also plays a role in regulating metabolism, immune function, and the body's response to stress. So if cortisol is high in your body, you are going to be experiencing metabolic disorders, difficulty in digesting your food, and you're also going to be battling with some immune function thing because your immune system will be low, exposing you to infections and then the way your body responds to stress. So you need to de-stress yourself, you need to deal with stress. Another thing that can lead to hormonal imbalance is poor diet and nutrition. Now, diet and nutrition plays a very huge factor and can influence your hormone levels. Now, with imbalances in nutrients such as some vitamins, some minerals, and some fatty acid, this can lead to an imbalance in your hormone. It can also affect the production and regulation of various hormones in the body. And these are some of the things that you should consider. Eat whole foods, eat organic foods, eat more fruits and vegetables, and avoid foods that are high in processed sugar, white flour products, greasy food, unhealthy fats, margarine, and dairy products. These are substances that can greatly affect your hormones. And then there is another one, which is obesity and unnecessary weight gain. So obesity can actually lead to um, insulin insensitivity, insulin resistance, and hormonal imbalances. Now, your body stores fat, and these fats are going to cause a resistance to insulin, and then it can lead to diabetes and um, other disorders like hormonal imbalance. And they can also produce inflammatory substances, so you have lots of pains and inflammation going on in the body. So, and there is another one, which is the medications. Medications can actually disrupt your hormones. There are certain medications and treatments that can, cause an imbalance in your hormone. Things like the steroid, non-steroidal anti-inflammatory drugs, contraceptives, hormone replacement therapy. All of this can affect the levels of your hormone and lead to hormonal imbalance. Chemotherapy and radiation for cancer treatment can also affect hormone production and regulation. And then there are also environmental factors. Exposure to environmental toxins, pollutants, and endocrine disrupting chemicals found in pesticide, plastics, and household products, even body care products and hair care products, can interfere with hormone function and contribute to hormonal imbalance. And then we also have the genetic factors. Now, genetic factors can also contribute to hormonal imbalance, and you also have to take care of that because, you can have genetic components that predisposes you to having hormonal imbalance. It can affect metabolism, and then it can affect the receptor or sensitivity of your hormone production. And then we have hormonal imbalance that it can manifest in different types of ways. So I'll come back, and then we'll talk about the different ways in which hormonal imbalances can manifest itself, so that you may know that these are the symptoms, these are the signs that I'm having hormonal imbalances, and then you will know what to do. So stay with us.